So where to begin? It's been an incredibly difficult year. We were faced with a new disease, none of us knew what to do. We started getting a few patients through the doors when the pandemic started, and we just didn't know what to do or what to expect or how to treat the patients. There was a lot of conflicting information internationally and nationally about what to do. And luckily some of that guidance was collated, and we got guidance from the college on how to treat patients, which helped eventually, and also we got to recognise what we were looking for with the disease, because obviously it's something none of us had ever come across before. Trying to rearrange the way we worked was incredibly difficult. We had to get used to PPE. We had to fit everyone with PPE, do fit testing with masks, learn to wear gowns and goggles, visors, gloves. So trying to look after people with a new disease was really difficult. None of us had come across this before. It's a bit like flu, but it sort of isn't. And patients that we thought might have COVID didn't, and patients that we didn't think had COVID did have it. And there were different presentations in different ways, and we had an awful lot of learning to do. I don't think I've ever done so much reading around one disease in such a short period of time in my life. Eventually the team kind of got an idea of how to treat these patients, but internationally there was lots more information coming through, literally on a daily basis, of changed treatments and different options of how to treat people. It was very confusing, conflicting advice, and difficult to manage. But we pulled together. The team was amazing. We had co-opted staff from day surgery and endoscopy, had aspirant nurses who sort of came to us before they qualified, and we all pulled together really well. Trying to communicate behind masks is difficult with each other and with patients, and we had to learn how to communicate as a team, which had been pulled together really in the last minute, so people that we'd never met before we were working with. But everyone integrated really well, and we sort of just did the best we could under very difficult circumstances. There was a lot of anxiety from staff about contact with patients. The media obviously was a frenzy about the dangers of COVID, and people were really worried. A lot of staff had their families worried about them, didn't want them to come to work, and trying to support them and sort of remain safe with PPE was a real challenge, especially again in the early days with the PPE shortages nationally. I think luckily at Harrogate we didn't have too many shortages, and we had the kit we needed, but there was so much anxiety with staff. I think the other thing that was quite eerie was coming to work through empty streets. You felt like you were the only person on the planet, and you come into the hospital foyer was deserted. Come to work and you were this little bubble, and it felt like you're on Mars or something, just completely isolated. But one thing that was incredible were the gifts from people, cakes, coffee, pizzas, the things that people dropped off, and that kindness from strangers was absolutely amazing. It just kept team morale going. So if any of you sent in anything to us, massive thank you, because it really helped.
My normal day job kind of came to an end on the Tuesday the 10th of March this year. I came to work that morning knowing that I was going to be speaking to the staff on my ward to say we were expecting to change from being the orthopaedic trauma and rehabilitation ward into the COVID admissions ward, and that we were making some plans for that. And within 6 hours, in fact, our first patients were coming in, so it all happened much quicker than we expected, and at that point it became very clear that everybody was very frightened. We were all really apprehensive. We didn't know really what it was going to look like. Was it going to be like what we'd seen in Italy on the TV screen? And we really at that stage we're still working with relatively small amounts of clinical information about this evolving disease. I was scared. Everybody I worked with was scared, and yet we had to try and support each other, and it became really clear at that first stage that the only way we were going to get through this was by working together as a team and supporting each other and looking out for each other, not just in terms of support for our jobs, but looking out for each other in terms of making sure we were doing our PPE correctly, that we were checking up on each other as we went into and left a room, that we were sharing jobs, so that we were making sure that transit between in and out of the room was minimised as much as possible, but whilst also trying to maintain the best standards of patient care that we were able to. The way the doctors worked in the hospital changed enormously for a lot of us. So a lot of the junior doctor teams changed around completely so that they formed these sort of super teams that worked in shifts. The medical consultants formed a group of 14 of whom there was 2 consultants who were sort of the duty consultants throughout the day, and we changed again our working patterns entirely. So there was no Monday to Friday, then Saturday and Sunday. It was just a 7-day week, and we all had a new shift pattern to work within that. And our surgical and orthopaedic and other colleagues supported that by this more senior grades within those departments stepping down into more junior roles in order that they could release their junior doctors onto the COVID wards. So it was a massive team effort within the medical staff, as well as the enormous team effort that was going on throughout the hospital. I have never been as proud of the team that I've worked with as I was during that phase. During the whole of the COVID period, one of the things that we were all very conscious of was that our relationship with our patients was changed because we're behind the PPE and because our patients couldn't have the visitors that they normally did, and for a lot of them who were very, very poorly, they needed a lot of support, and that touch, the close approach simply couldn't be there, and it was difficult for us as staff caring for them. I think all of us were very conscious of how difficult it must have been to be a patient during that period. And even now that continues because we're still wearing all the PPE, but that during that particularly acute period when everything was very busy, was very stressful, was very hot. It was very hot at times for us and for the patients. And I think a lot of the things that we will remember and retain were the difficulties we had sometimes in having that human relationship that's so fundamental to what we do when we're dressed up in the PPE and in that stressful situation.